Come on
Come on
in.
in. Welcome to the Doctor's Lounge with Ivy and George, where we invite you behind the scenes in healthcare to promote transparency and good communication and conversation in medicine. So, we have a very special episode today. I'm going to be talking with the amazing Dr. Ivy Kid, who I call Ivy because she's my wife and she's amazing. We had a bunch of questions discuss about your healthcare journey. Everyone may not know, but you've been through a crazy healthcare process recently. I think it's good if you can tell people about it, share the experience, and help let people understand that a lot of these things are more common. So, can you tell us what started, what happened with your healthcare? How did everything get started?
It was a pretty intense journey that truly came left field. I was doing my work normally. We actually celebrated an anniversary together. We were out in Los Angeles and went to where we got married. Shout out to Waldorf Astoria. And I also had some work and projects going on there. On the flight back, I was actually sick with an upper respiratory virus. I thought maybe it was COVID, perhaps, or just like a run-of-the-mill norovirus. And I almost debated not taking the flight, but there was work to be done when I got back, so I decided, let's go. I'll just sleep on the plane. The next day, I felt okay. The day after, I started having these terrible headaches, and I am somebody who actually suffers with migraines. It didn't used to happen when I was younger, but as I got older, it was if I'm dehydrated or I know my triggers. And this headache sort of was a little bit more milder in intensity, and I wasn't dehydrated, so I thought, oh, that's, unusual, but sort of wrote it off. I took in a leave, and that normally takes away my symptoms. And to my surprise, the headache was persistent. And that was very unusual. Oftentimes, it can go away with some medication, with sleep, with drinking Gatorades. And I still didn't worry about it. I still sort of pushed through work. I was on the wards. I was also teaching in the hospital, and it wasn't really impeding any work at all. It was something of like an annoyance and something that I tolerated in the background. So it was a mild headache, but then it started to intensify, especially with movements. Like if I was going from a position laying down to seated up, I would literally hold my head like this.
I remember. I mean,
Yeah, because the intensity would fluctuate. And I thought, this is not normal. And we actually made a couple of phone calls to neurologists and our friends. They weren't as worried. They said, okay, migraines can present in different ways. Try magnesium, try different things. And I really wanted to avoid an emergency
room visit.
visit. Part of it because of work, because I didn't want to not only wait in an emergency room full of people who are sick and get worse and expose myself to unnecessary viruses on top of what was going on, but also I didn't want to be tired the next day if I had to go to work, or there's only so much time in a day, and I was trying to conserve my energy so I can be good enough to work. And it was working. I mean, it was.
She was
I was
able to
able
keep
to.
functioning. She was
Yeah, I was able
pushing
to.
through. It was hard. I mean, I was here seeing it. There was
Mhm.
a lot of fighting through things, and it was like normal things were getting more difficult. But
Yeah, and we did make appointments at that point. We were making
primary
scheduling
care,
primary care, neurology,
neurology.
but of course, it all takes time. Like, it's not next day appointment. We were still fortunate enough to get an appointment even sooner. I
I mean,
remember growing up and my mom raised me. She was a single mom and we didn't have a ton, but we were fortunate enough to be in New York City with a ton of access to care and resources. But even then, my mom was sick and she made an appointment, it would not be until a month or two out.
yeah.
And I frequently remember making emergency visits, and it would just take the whole entire day. Like, I would
Yeah.
have to miss school or miss work, and she would have to miss work. And they would do some tests, and they would say, okay, you're not dying, or you don't have an emergency. We didn't find much. And then place an outpatient referral, which, took a month or two to get, and it was just be a cycle. And so that's how I was growing up, and that's
Yeah.
why the decisions that I made for myself, inform the experience
Yeah.
I've had
Yeah.
in the past. And so I just did not want to
Really.
spend a ton of time there because it just brought me back to a lot
Yeah.
of those experiences. And bless the emergency, medicine folks. I mean, that's their job, is to rule out any
Yeah.
emergency. So, but that doesn't mean that we're doing
It,
preventative medicine there,
no.
and we're definitely not doing things that are so not acute, but maybe urgent, that there is an urgency. That's probably the bucket of
Yeah.
medicine that people need attention.
Well, and that's probably, you've highlighted one of the issues and big gaps in the system that happens a lot is people will not know where to go because, like you're saying, if someone can't schedule a primary care doctor's visit until much later on, or it seems urgent when something happens, and just trying to find the right way because even, you take time out of the day to go see the doctor and they're like, okay, that's not my field. So we got to send you somewhere else. You need to see a
Yeah.
specialist in this or that. Like those things then make people feel like, well, why did I just take the time? And they learn to just push through. So that's what Ivy was doing. She was pushing through,
And
having the
also, and you
symptoms.
have to, right? I
Yeah.
mean, back then, my mom definitely had to, but now we're in a different space. Maybe
Yeah.
I didn't necessarily need to, but I want to. So that was definitely eye-opening. So we finally got an appointment with a primary care physician, and one of the things, and I've been through this before, is when, they see a young, seemingly healthy, woman, there's not really a call for urgency, and I get that.
She's being very polite to say people diminish her symptoms and brush it off. And that's what is, I personally don't always have that same experience, but I've seen it so much with
Yeah.
Ivy where we'll go
And we
in.
can't, and the thing is, we know there's definitely real statistics about bias, not to diminish that. For my individual experience, I don't know if that was the case, so that's
Yeah.
not what
Yeah.
I'm saying, but I also think that as a physician, if I'm sharing with you, I am having headaches that are alarming to me,
Yeah.
and I'm actually able to speak about a lot of the nuance,
Yeah.
then I would think that that would be more attention,
Taken
called to
seriously
attention or
and
taken seriously. And, I think everybody's trying to do their
yeah.
due diligence. And unfortunately,
Well,
sometimes things do get missed.
what's tricky is a lot of times, we talk about these like alarm symptoms, things that are like, we are taught that if you hear these things, that's when an alarm bell goes off, you need to rule out bigger stuff. And especially from like a primary care perspective, they see, the most of them, let's say, if 95% of the people with a cough and certain things come in, it may be virus, but then there are a certain amount that are infectious pneumonias. And even there's some that could be something deeper,
Infectious pneumonia that need to be hospitalized.
hospitalized and treated with antibiotics.
And
And
I think for the most part, places know how to triage and
yeah,
escalate care. A lot of it is timing. The why does it take so much time to get imaging tests like a
yeah,
CAT scan or an MRI? So it's that piece of care
Yeah.
coordination, and when there are things that are urgent, that is really a gap. Yeah, that's definitely one of the challenges that we had. But we were also, again, like, very lucky to have people, our friends, and I can't imagine for people who aren't in the
Yeah.
healthcare system, how they would navigate something like I had.
Yeah, because it's like we know the people to try to see, we can call in favors to try to get seen, to make sure things are highlighted. We know what's alarming. So even that's where I think the next step in the story was that, like, people were diminishing or not as worried as Ivy, who knows the alarm symptoms, knows medical things, knows what to worry about. She was appropriately worried. So
Well, it's also that effect of, if you're doing well and I do it because I push through, it's that effect of, "Oh, she's got this. She doesn't need help." And
yeah,
that sort of sentiment is really across all different,
yeah.
things that we go through in life. But unfortunately, in health, it's definitely more of a serious thing, and there's consequences. So yes, was fortunate enough to be seen by the primary care, and I really had to do a lot of self advocacy. I
Yeah.
said, "This is alarming. This is not my usual. I don't think this is migraines. Please, please." And I
Yeah.
begged for an MRI. We actually, I think
That's
ultimately we got an MRI through someone we knew, or we
yeah.
paid out of
So
pocket for a
yeah,
lot of
that's
the.
there were ones where we knew people, so we were able to pay out of pocket for things, and we were also able to, like, because we are both physicians, we knew how to advocate in ways that would get people's attention to try to get the testing done. And that's something
And
that
the reason why we share this with you is we call out the unfairness and this disparities that are existing nowadays.
well,
So that's our whole purpose in sharing this with you. Not to say that, oh, we had access. It's that we are fuming. We want people to be able to have access just like us.
and it's also, I think, along with that, it's also the same part, what you need, like, what are the keywords to say to get access? What are the ways that, like, there's certain words that we know that, like, okay, if someone comes into the ER with chest pain and they say,
Worst
oh,
headache of your life.
it feels
Worst
like
pain of your
someone's
life.
elephant is sitting in my chest. We're
Yeah.
like, okay,
And we're
that's
not saying, obviously, we're not saying don't lie, right? Of course. But unfortunately,
it's
you want to get attention.
well, and
And
it's
so, and if you really need it, and if you really feel you know your body the best, right? Who knows your body better than you? If you are feeling like something is not right, go with your gut, go
yeah,
with your hunch, because I definitely felt like this was not normal. And this was even beyond like a clinical gestalt intuition. This was beyond like what I knew from the textbooks,
yeah.
because not everything has fit into the classic textbook answer. Because migraines, for example, can be so many things. I mean, you can start seeing visual disturbances, vision issues with migraines, but there's a lot of other bad stuff that can,
Well,
cause that, so.
I think the key thing that we're saying is knowing what things are alarming. So then if you are seeing these things, making sure you verbalize it to the medical team. Because, if the medical team hears certain things, they take it seriously. But the same, if you as if Ivy as the patient was like, "You're right, it's nothing," and, like, not listening to herself and trusting that instinct part, that's when things could get delayed further and further. And so once we got the MRI, do you want to share the news of what they found? Or
Yeah, so, well, it was a series of unfortunate events because even the MRI read was missed, the diagnosis, the initial one, and so, unfortunately, we had to go to the emergency visit because
later
once
on?
later on, because once the first MRI was read as normal, we said, "Okay, well, I
Yeah,
guess things are okay." I still knew that things were bad and not normal, but I went back to work and I went
Yeah.
back to my normal life. Unfortunately, it hit really hard. I started getting whole body muscle pain, and then it started becoming weakness, like to the point I could not even pick up my phone.
She couldn't
It was
get
so
up out of
unusual.
bed.
I could not
Like,
get up. Yeah,
I physically was
to
helping to sit her up and
yeah,
then stand up just to walk anywhere. And it's like,
yeah.
this is
And
not,
and I still what's crazy is that I still was able to work because my work involves walking, and I would just stand with, you know, I would do the
yeah,
work, and if I had to push doors, I would wait for other people to push the door for me, so I was able to
still function at
still
work, but
function,
clearly functioning below her baseline.
baseline. Yeah, absolutely, absolutely, and so the final straw was all of a sudden my muscle locked on my spine, and I couldn't move, and so finally we said,
Mhm.
"Okay, well, we're gonna do the 12-hour visit in the emergency room." And I also had some trouble breathing because of the muscle weakness, so that was very obviously
Yeah.
that at that point. So we went I do wanna share a lot of it is my fault in that I had some alarming symptoms, like the vision loss for a little bit as well, and I think at that time we should have gone to the ER. Some
It's
of the symptoms came and went, so I don't want this to be a,
even
the
that,
healthcare system sucks or is
no,
imperfect, which it is, but there's also things that we could have done on in my end, I could have
there's
done.
always things. And it's just a part of sharing the story in my mind is going through the experience, letting people know that, like, even as two physicians, we still face these hurdles. Some of it, they joke that like doctors are like the worst patients because you don't take the advice, you don't do the things, you struggle
And
to,
I felt I was the best patient because I could give, like, a very pristine history, and the nuances. I could share that. I could even help formulate a, medical diagnosis. I was very strong in my medicine, but, yeah, unfortunately, it
yeah.
for better or worse. The journey was hard, but of course, knock on wood, everything is good today, and I think it's because of
So,
all of it. So, yeah,
yeah,
we'll go through and when we were in the hospital, I think there was still a lot of advocacy necessary in it.
mm,
It looked a little different. I think we were advocating for more communication.
yeah.
I was just shocked where some, you know, uh, I was just shocked that I think what I took away from that is the best thing to do is to make sure that we are communicating uh the thought process behind everything that you are offering, interventions that doctors are offering, as well as communicating a plan of care and
Mm,
for the day. And even if that plan is, hey, I don't know, and I'm
yeah.
uncertain, at least giving that communication, I think, can be so helpful.
And I think that's one of, so in a lot of these communication issues, Ivy had come up with a very good mnemonic for patients to
So
help,
we both did. We
but to
both
help
did.
come up with a good way to communicate and make sure everyone's on the same page. So it was, do you want
You go ahead.
to, it was like, you got to remember your ABCDs of communicating in the medical space. So A is ask for a family meeting. And so what that is either a meeting with your loved ones, family members, but also with the medical providers and all the different specialists. So if you have the primary internal medicine team, you could have neurology, cardiology, whoever specialists are engaged in your care and have a big role to play. We want them all together so everyone can talk and get on the same page. And that helps with so that the different teams know, so the patients and families know and can understand what the next steps are, what we're waiting on, what if this happens, then we do that, and like all those steps.
We all know how hard it is for some folks to be all on the same page, but
Yeah.
I think, Yeah, patients definitely can advocate for that and making sure I always made sure that my husband and my mom was aware of everything that was going
Yeah.
on. It was really helpful.
Well, and it also helps that for the medical teams, a lot of times it's difficult that, they only really update one family member if they're going to update someone. And it's different teams. And then so I know that families can get overwhelmed. They feel like I got a call from five different doctors, each one saying that, so it helps here where everyone can get on the same page. If there are like, if my mother in law is there too, if she needs, sometimes she can ask a question. And it's, for the team, it allows for one set time where they can kind of go through a lot of stuff. Everyone can kind of come together and we can have a clear next step set up.
And
So,
I think even and trying to coordinate care amongst providers, I think can be challenging. So even if it's writing things down and letting other providers look at it, that's another way
yeah.
to have coordination and communications.
So, what could happen a lot of times
Yeah.
just with that is because I've been involved in family meetings where maybe the specialists can't come, but in their notes, they can give their clear recommendations and reasoning. And then, so at least, let's say the internal medicine doctor is able to give that update and some amount of explanation. And then if we need more, sometimes we can call in, or, there's ways. Even I've had times where some specialists are available over the phone and we have them on speaker, we talk with them, and then they can continue going. So there's fluidity and balancing to figure it out, but it's important to kind of, like, as a patient and family member, to know to ask for that and to try to make sure so you can get everyone on the same page.
No,
So that's
1000%.
A.
Absolutely.
So now B.
Yeah, and I think we can go through the
Okay.
story as well. So, yeah, that was really great. And I really want to take the opportunity to praise an institution, NIH. We don't really talk too much about institutions, and
Yeah.
we're not representing an institution, but I want to. My experience as a patient at NIH was phenomenal. It was just the time that the providers took to speak with me, and they asked such great
Yeah.
questions, really trying to figure out, and I just felt really heard.
Yeah.
And I think that is part of the ABCDs was
Yeah.
the B and the C. C is concerns. So
Say B
sharing my
before C.
concerns, yeah, say B before C. I just felt like it was
Yeah.
important. C,
Yeah.
concerns, and also asking the doctor their concerns. One of my big concerns, so the diagnosis was unfortunately a mass. The mass was in the midbrain. Probably you guys have heard of a pituitary mass. And although it can be common, mine was a little bit uncommon. Without saying too much, it was different. And it impacted the reason why I started having weakness and the headaches. What doctors shared with me is that I had a bleed. It's called apoplexy. It actually is life-threatening. It started impacting all my hormones. All my hormones were low, and the reason I was having that weakness was the cortisol was low. Cortisol is your fight or flight hormone. It's a stress hormone. You actually need it to live. And so that was low. That is the
Yeah.
life-threatening part of it in this. And it's so funny because I felt at that point when I couldn't breathe and the weakness, I felt like it was the end. I felt like there was something off.
Yeah.
I actually had dreams where I saw people who had passed. Like, that's a
Yeah.
whole other
Yeah.
conversation. At that point, the good news is once it's found, you can replace hormones. Yeah. I was on steroids for a good bit. Again, everything has normalized now, so that's amazing. Very lucky, very fortunate for that. The the one also another hormone that was so important was if I can share,
Yeah.
because
Of
we
course.
are married, it impacted my periods. And that was brought up by an endocrine female doctor at NIH. She has
Mm.
some great questions. And I thought, wow,
That's
like a woman physician would think about all those things as well. So I really appreciated that, and it was also part of the goals that I was trying to achieve, banding our family. These things were so important. So to have someone understand my goals and making
And
sure that that is a priority
asking
amongst
about
what
it.
the decisions are or my options are for care. So I really wanted to share that.
Yeah.
And if you want to go through the
So
ABCDs,
yeah. A, ask for a family meeting. B,
B is big picture.
what's the big picture?
What is the big
So,
picture?
and that often, and medically, that can be, we talk about what's the best case scenario, what's the worst case scenario, and what's the most likely scenario. Because it helps as the patient and family members, you get an idea of what they're talking about and the whole range, and it lets
And
you
the whole range of options.
options and possibilities and everything. C is concerns,
We
like she
already
was
went
saying,
over.
what are my concerns and what are the doctor's concerns? And then D is deal breakers. So like if there's something that is like a hard line of like this is crucial. So examples of that, Ivy had told me the story once where they were having a family meeting and one of the patients told her that the most important thing for him was to be able to get to his child's wedding in a few weeks. And so knowing that, the team was then able to adjust medications, treatments, plans to try to help make that happen.
Yeah.
But like, had he not verbalized that, maybe it doesn't happen. They don't realize how important it is. And there's things that could be missed. So those are very important, like to let the team know, like, this is what's the most important thing for me, because that helps guide it. Because I always joke around, I'm like, for the patient, you're the patient, you're the star of the show. You're guiding this ship, and based on where you want it to go, we can try to help make that happen. But if you don't know to advocate it and we don't hear it, then stuff can get missed, and later on is when there's regrets, and that's what we don't want.
Absolutely. And our goal is we recognize that even though we're part of this healthcare system, and I think there's so many people that go into it, they're do-gooders, they
Yeah,
want to help. I feel like there's far more people who want to help than hurt.
bro, no one goes through 4 years of medical school,
And then
3 years of residency, and all this
and
to not
not just
want to help.
doctors, providers,
Yeah,
APPs and right, PAs,
yeah,
NPs, nursing,
and
everybody, they all go through social work, chaplaincy, all the different disciplines. They really want to help. And we also recognize that the healthcare system sucks, right? It's terrible. And we're often not the
yeah.
ones making the decisions.
No, it's like you're saying,
And
it's
I
like,
don't even know if there's somebody to blame because
no,
everybody looks through their lens
yeah. I mean, some of it's how the system works, and this is the system.
we've built.
I mean, there
Yeah.
are people who clearly benefit more in the system, and those who don't.
Well,
But
I think we have to get the values right. As an as a system, we have to understand what core values of
yeah,
this. And in healthcare, it should be good health.
and
And
caring.
part of what I think is so important and what we want to share with you is self advocacy. And we recognize not everybody will have the tools with communication or really understand how to navigate healthcare. Like I said, I myself, growing up in New York City, single mom, we really didn't have any tools. We didn't understand. I remember being so scared in the emergency room when my mom was sick, and I thought, okay, these are people who are supposed to help. I'm a kid. I don't
Yeah,
know what to do. And we didn't really have the proper channels, or I didn't know what to say or what
yeah.
to do. I didn't even really understand insurance. And we had Medicaid insurance where I remember having to recertify my mom, and we wrote a letter saying that, yes, we make this much or we live here. And I handwrote the letter because we didn't have a computer to print. So yeah, we both know what the struggles are,
Yeah,
and we truly hope that you guys please ask questions in the
yeah.
comments, and we're here to help.
And the same, if there's any big questions you have, that you'd want us to discuss? Like this
We don't give
Doctor's Lounge, this space is for us to help translate. The way I joke is like we're translating medical to English. So we're going to help you guys understand what things mean or do our best.
yeah,
And
we don't give individual medical advice, so this
this
is
is
just for education.
everything discussed with your doctor, you know.
Free educational
Yeah.
content. We don't make money off of this, even
Yeah.
though it's a YouTube channel. We're not monetizing anything.
Yeah. It's a lot of it is just to help people learn and kind of share the wisdom we've gained through our experiences.
Connect, yeah.
Yeah. I had a attending once who was like, don't learn from other people's mistakes. I had an attending once who said, don't learn from your own mistakes, learn from other people's mistakes. Like kind of like pick
It's a
up
good
from
one.
those experiences that people have had and use it to adjust and improve. And so that's from our end. We want you to know the mistakes we've made. We want you to know the things as patients that we wish people knew so that altogether the communication will be better. And the hope is everyone's healthcare can be.
Thank you guys so much.
Thank you guys so much. Thank you for sharing, baby. Thank you for
Thank you so
going
much.
to everything. And
Thanks for being an easy interviewer.
and yeah, let us know any questions. And thank you again. It's been a pleasure having you in the lounge.
Bye.